So we're now in a situation where everybody's talking about complexity. And the first chapters of books will tell you how complex the problem is. Subsequent chapters with different authors will still be the reductionist research that has always been going on. And the reason for this is that we've reached a stage in our science where there's strong motivation to understand things more complexly, but very little insight for doing it. And so it's a programmatic statement. At various times, disciplines from the outside have offered to help biology deal with complexity. There was information theory, catastrophe theory, cybernetics, systems theory. Now you hear more about complexity theory and chaos theory. And all of these grasp onto an aspect of the complexity of the world, but they're not sufficiently informed by the objects of study, and therefore their abstraction doesn't come back to earth. As you increase the number of variables, if you study them in a traditional way, the project becomes more and more difficult. The expense is greater. The amount of data collection is vastly increased. The data processing becomes an enormous task. The statistical models become more difficult. What you might do then instead is ignore variables which you can't measure. And so one of the things that will happen is that you're regulating diabetes, let's say, and a model will say that it depends on the amount of sugar you ingested and the amount of insulin that's circulating, the glycogen stored in the liver, and the footnote says the psychological state of the patient is also important. But they can't really tell you how it's important. You might tell a patient, if you feel trembling and disoriented, you may be having a hypoglycemic episode, come into the clinic immediately, we'll do some tests. The trouble is that coming into the clinic itself is stressful and can mess up the tests. We know that blood pressure is higher in patients when they come into the clinic than at home. And we've already learned a little about how that works. There's the white coat phenomenon, that if the blood pressure is being measured by somebody who you imagine to be of higher status than you, the blood pressure will be higher. Conversation while it's being taken will raise the blood pressure. There are two major circumstances in which conversation does not affect the blood pressure. Talking to animals, or in autistic people. Autistic people, in some sense, are not relating socially to the people they're talking with. It doesn't have the social affect that other people experience, therefore it doesn't affect their blood pressure. And when you're talking to your pets, you can count on their unconditional acceptance. And so there isn't a nervousness about saying the wrong thing, about being judged, and so on.